Member for West Vancouver Capilano.
Thank you, Mr. Speaker. On July 9th, a woman was admitted at Lionsgate Hospital for possible heart problems. But instead of getting the help she needed, she spent 2 days lying on a stretcher in an overcrowded waiting room. By mid-afternoon of July 11th, 2 days later, she was found unresponsive by a family member and later died. This is what Adrian of the BC Nurses Union said about this tragedy, quote, "Nurses are upset. They're angry. They feel this is something that absolutely could have and should have been prevented. This has happened at the Lionsgate ER, but this could be honestly any emergency room in the province at this point." And what was the Minister of Health's reaction? The minister downplayed what happened, claiming that the woman received, quote, "significant care." Now, I can't imagine that having anyone in your family die on a stretcher in an overcrowded waiting room should ever be considered significant care. This province deserves a health minister that prioritizes outcomes. Will this minister do the right thing, stand up and resign?
Minister of Health.
Thank you, Honourable Chair. And as members of the House will know, when individual cases come forward, we don't comment in a specific sense about those cases. But what I would say here, and what I was referring to, was the care provided by doctors and specialists and nurses, in this case, in the Lionsgate Hospital, Honourable Speaker. There are issues, especially, Honourable Speaker, in that period, in terms of having people leave the emergency room and go up to the wards. It's why it is so important that we have a healthcare system that allows them to do that, that allows people to have supports in the community so that we have room on the wards. But in that case, we went through in detail that issue with Vancouver Coastal Health staff, Honourable Speaker. I think for the family, Honourable Speaker, there is absolutely nothing to be said. It is absolutely tragic when someone passes away, particularly in those circumstances. And that's why we have to do exactly what we're doing, Honourable Speaker, which is in a very challenging time for the healthcare system. Add healthcare staff, train more, recruit more, so that patients get the care they deserve, not in a location that clearly is not acceptable, Honourable Speaker, but get that care in their own room where it should be in a hospital like Lionsgate. That's what I said at the time. I expressed my profound sadness at the time. Nobody downplayed anything. And to suggest that we're doing that, Honourable Speaker, for the sake of political rhetoric, I don't think is the right path.